Audio check. Testing 1, 2, 3, 4. A little louder. Audio check 1, 2, 3, 4. Testing 1, 2, 3, 4. Audio check.
The only reason I asked, I could hear you in the other one, but I wanted to make sure I was able to blast it out when you talk louder because I wanted the fit.
Testing 1, 2, 3, 4. Audio check. Testing 1, 2, 3, 4. Testing 1, 2, 3, 4. Audio check. Sound check. Microphone check.
Test, test, 1, 2, 3. Member mic check, member mic check, 1, 2, 3, 1, 2, 3. Yeah, let me know pretty much. Yeah, and I sort of remember that from last time. Oh, well, no wonder you can't. Yeah, that's not gonna. So maybe it won't have to be so loud. You're just slow to begin with. Let me know when you're ready for another one. Test, test, test. 1, 2, 3. Mic check, mic check. 1, 2, 3. Test, test, test. 1, 2, 3. Oh, I might go back up to 50. When? Thank you. Witness mic check. 1, 2, 3. Witness mic check. 1, 2, 3. Test, test, test. 1, 2, 3, test, test, test. 1, 2, 3.
Good afternoon, everyone. The subcommittee will come to order. I would like to welcome everyone to the first hearing of the Subcommittee on Oversight and Investigations of the 119th Congress. While not new to the committee, all of our members, other than myself, are new to the subcommittee. I'm confident that we will continue to work in a bipartisan manner to hold the VA to its mission of providing world-class care for our veterans. Additionally, I would like to congratulate Mr. Doug Collins on his confirmation to serve as the VA Secretary. I look forward to working with him this Congress. Last Congress, we uncovered countless instances where the VA failed to hold bad employees accountable and ultimately let veterans down. Time after time, career government employees were protected at the expense of veterans. Protecting bad employees from the consequences of failing the veterans they serve is unacceptable, especially at the cost of the taxpayer dollar. Veterans should always be at the forefront of VA's mind when they make decisions. Unfortunately, too many times bureaucracy is put first and veterans come in second. I do believe that 99% of VA employees are dedicated and hardworking public servants that in many cases want to serve their fellow veterans while still working in a productive, accountable workplace. Over the past few years, whistleblowers continue to describe situations where VA leaders face little discipline despite investigations substantiating the allegations against them. It takes an incredible amount of strength and fortitude to come forward to blow the whistle on wrongdoing in the VA. I want to take a moment to thank the whistleblowers who have courageously come forward to the VA and to Congress to bring attention to these problems. Your bravery is one of the reasons we were able to do our oversight work in Congress. In Buffalo, one veteran with cancer did not receive care for 10 weeks because the leadership at the facility failed to connect him with the care he needed. This committee sent multiple questions regarding ongoing investigations or disciplinary actions for this failure in our care, and our questions went unanswered. In my own district, the poor management at the Hampton VA Medical Center caused the facility to be left with one anesthesiologist to serve every patient. Despite VA taking action, I have heard continued allegations about the quality of care issues at Hampton. To date, I have still not received clear indication that the VA fully investigated the local leaders at this facility. As a former provider and nurse practitioner, these stories are heartbreaking. Our patients deserve better. Unfortunately, this is not an isolated issue. Even more shocking, there have been instances where the VA promoted leaders even after they were found to have engaged in misconduct. This is why Chairman Bost, along with every Republican on this committee, reintroduced the Restore VA Accountability Act of 2025. This legislation makes clear that bad VA employees need to be held accountable to ensure that the best federal employees are serving veterans. Congress needs to solidify this good government measure. This legislation will address many of the concerns and challenges that we will hear from our witnesses during today's hearing. As a provider myself, I know that the leaders at local hospitals play a critical role in ensuring patient safety. They are responsible for creating a positive work environment that allows nurses and doctors to care for the patients they serve, and at the VA, that is veterans. If the leaders are not holding themselves to a high standard, then they do not need to be in leadership. It's that simple. As someone with experience working with the VA and veteran care, I know firsthand the bulk of VA employees do good work and provide safe patient care for our veterans. This work is valuable to our nation, and these employees deserve safe and sanitary working conditions. The American people have given us a mandate to make sure their government works for them, not poor-performing career government employees, and the VA is no different. It should go without saying that veterans have earned a system that serves them well. I'm looking forward to working with the Trump administration to course-correct the mistakes from the previous 4 years. I look forward to hearing from our witnesses today about how the VA will hold its employees accountable to the mission. By restoring accountability at the VA, we will ensure that the VA puts veterans first. I now recognize Ranking Member Ramirez for her opening comments.
Thank you, Chair Kiggins. I look forward to working with you on the Oversight and Investigation Subcommittee as its ranking member. I believe we, as members of this committee, have an obligation and a shared responsibility to ensure that the VA is succeeding in its mission to provide veterans world-class health care and benefits that they have not just earned, but that they deserve. But the title of this hearing and the Republican majority's approach to this topic makes it clear to me that not everyone in this room takes that responsibility seriously. It is clear the intent of the majority is to undermine the VA and its mission by vilifying and persecuting an important asset. the hundreds of thousands of public servants who show up to work every single day to serve our veterans. Let's keep in mind that a third of VA employees are veterans themselves. The end goal of their vilification is the privatization of the VA for the profit of Trump's billionaire bosses. So I want to suggest a more appropriate title. Perhaps this should be more like Unaccountable Billionaires First, Veterans Last, the Musk-Trump Agenda. In the 18 days that Trump has been in office, he has gone on a chaotic rampage to make the federal government a hostile workplace for its employees, for its 3 million employees. Trump wants to either fill those positions with MAGA operatives and loyalists or outsource contracts to his billionaire bosses who were lined up right in front row at the inauguration. Folks, that doesn't feel like it's about our veterans. It's not about accountability. It's about profit. And Trump is not even hiding it. On January 31st, he said in the Oval Office, after sending federal employees a buyout email identical to the unelected, unaccountable President Musk, who sent to his former Twitter employees and said, quote, "It's our dream to have everybody almost working in the private sector." Trump and Musk are the definition of horrible bosses, and they're using the bad boss playbook to push public servants out of their jobs. For those VA employees listening, look, I want to say this to you. I know you have figured this out yourselves, but do not take deceptive offers. Stay in the fight with us. We need you. Our veterans need you. What Musk and Trump are doing to the federal workforce through various executive orders, OMB memoranda, and tweets is demeaning, is shameful, and is threatening. And their actions are going to have dangerous impacts for our veterans. Because within hours of being back in the office, Trump ordered an across-the-board hiring freeze at federal agencies. After the outpour of confusion, of concern, and Trump-inflicted chaos VA employees experienced, Trump eventually gave into the onslaught of pressure from Democrats and exempted some VA healthcare positions from the freeze. Let me be clear. Despite our advocacy and pressure, there are still thousands of vacancies for jobs at the VA that will go unfilled. These jobs are mission-critical claims processors, disability examiners, maintenance workers, environmental management technicians, food service workers, just to name a few. The VA cannot deliver the benefits our veterans have earned and deserve without these people. Patient safety cannot be compromised because we know what's going to happen. Veterans are going to suffer. But that's the whole point, right? That is exactly what Trump and Vance want. They want to cripple VA so they can sell it off piece by piece to the highest bidder. The greedy billionaires sitting in awe in the front row at Trump's inauguration stand to turn their billions into trillions at the expense of federal workforce, everyday working class American taxpayers, and ultimately veterans. I want to make myself very clear. I take our oversight responsibility very seriously, and in my role as a ranking member, extremely seriously. Since I joined this committee, there have been several investigations into employee wrongdoing that came to our attention, and they were alarming. We heard hearings last Congress that touched on issues at the VA Central Office, Hampton, Loma Linda, Eastern Colorado, Buffalo, and Mountain Home. In each of those cases, the Inspector General and VA identified wrongdoing, rooted it out, and disciplined the employees in accordance with the law. It is a misrepresentation of the law to say that VA does not have adequate legal authority under Title V to hold employees accountable. VA discipline employees under Title V every single day. And I have no problem with holding employees accountable, and I implore the VI to do so to ensure veterans are receiving the best care and benefits they deserve. What I'm not going to be standing for is idly an excuse of my colleagues across the aisle as they complicitly work with the Trump administration to abuse their power, subversion of due process rights afforded to federal employees, and the deconstruction of the services and programs that provide veterans the benefits they have earned and they deserve. And look, if we want to have real conversations about accountability at the VA, let's have it. I'm at the table ready to talk. And I know that my colleagues are as well. Let's talk about ensuring that veterans get the benefits they promise. Let's talk about improving training for HR and supervisors. Let's talk about breaking down reporting silos for employees to disclose mixed conduct when they actually see it. Let's talk about our expectations for leadership when issues arise at a facility. Let's talk about ensuring VA staff work in an environment that empowers them to put veteran safety first. When we have a president who removes over a dozen inspector generals charged with being independent arbiters of truth and transparency in government in the middle of the night, I find it hard to believe that this is the party that is truly interested in making the VA more accountable for veterans. So with that, I want to introduce our minority witness today, Mr. Donald Sherman, who's going to be joining us from Citizens for Responsibility and Ethics in Washington, or CREW. And CREW's ethos is Americans deserve a democracy that's ethical, accountable, and open. I couldn't agree more. If there's an expert on government accountability out there, it's you, Mr. Sherman. Thank you for being here, and I look forward to your testimony. With that, Chairman, I yield back.
The chair now recognizes Ranking Member Takano for 5 minutes for any remarks.
Thank you, Chair Kiggins, for this courtesy. Let's talk about accountability at VA. If my majority colleagues want to use this committee's time to take a look back at the Biden-Harris administration, I offer to take us back a bit further. I appreciate the opportunity to do a history lesson for those who may be unfamiliar or who have forgotten how Trump and his lackeys sabotaged VA from within during his first administration by sowing fear and hostility in its workforce. He is following that same playbook now that he has regained power, and it is clear that Trump is on a witch hunt against VA employees. Just earlier this week, he sent Elon Musk's entourage to VA central office to do who knows what. Trump has allowed Musk's team of teenage interns to access, collect, and poke around the private information of American citizens at Treasury, some of which includes veterans' data, and I'm deeply concerned that they are doing the same at VA. Veterans are at very real risk, and we demand answers. Unelected bureaucrats and billionaires now have access to hordes of private data, but are not being held to any of the same privacy standards we ask of VA employees or partners. That doesn't sound very accountable to me. But perhaps this is all part of the Republicans' plan for VA. As I have explained many times, a key step of the Republican VA death spiral is an erosion of veteran trust in the VA workforce. That's the purpose of this hearing today. My colleagues are painting a distorted picture of the past to make their case as to why Congress needs to rush to pass their incredibly flawed and unconstitutional Restore VA Accountability Act of 2025. Let me tell you why their case fails. This is their third bite at the apple, to attempt to make, and I say to attempt to make it easier for VA to fire employees. I say attempt with emphasis because when the Republicans tried this in 2014 and 2017, they failed egregiously. And veterans and taxpayers were left holding the bag. The 2014 Choice Act included expedited authorities to remove VA senior leaders or demote them to a lower position. Employees who were removed or demoted using that authority challenged the law's constitutionality in court. The Department of Justice ultimately declined to defend the law from those challenges, and VA ceased using the law to discipline employees. Now, I want to be clear that I did, in fact, vote in favor of choice and the VA Accountability and Whistleblower Protection Act of 2017. We were still dealing with the fallout of the Phoenix wait time scandal, and at the time, these bills seemed like they would help VA weather that crisis. However, hindsight is 2020, and I learned a valuable lesson: not to trust Trump with power. Instead of using the 2017 law to improve VA, Trump and his corrupt allies weaponized the bill to intimidate employees who were perceived to be unloyal to Trump and to remove employees without due process. During Trump's first go-around at VA, his team set up the Office of Accountability and Whistleblower Protection, otherwise known as OAWP, as required in the 2017 law. They then used that office to retaliate against the whistleblowers they were supposed to protect. I wish I was making this up, but it's well-documented truth. The Inspector General and other watchdog organizations like the Project on Government Oversight and Government Accountability Project helped bring this malfeasance to light. Ultimately, however, during the Biden-Harris administration, OAWP was able to turn things around and become a respected organization we regularly relied on to investigate and recommend discipline for employee misconduct. The death knell for the 2017 law came when the court scrutinized its implementation and VA ultimately quit disciplining employees under its so-called Section 714 authorities to avoid further litigation. As a reminder, this is exactly what happened with the 2014 law. Settlements from the use of the 2017 law resulted in $140 million taxpayer dollars being paid out to former employees. And if that's not a failure for veterans, I don't know what is. The Restore VA Accountability Act of 2025 is just more of the same. It is essentially a codification of Trump's various executive orders to give his political appointees sharpened tools to exact swift justice on VA employees for perceived disloyalty or insubordination. They want to make it as easy as possible to fire VA employees without cause. It's that simple. Restore is opposed by nearly every major labor union. VA has testified time and time again that they do not need the authorities in Restore to hold employees accountable for misconduct, nor will Restore speed up the disciplinary process, contrary to what my colleagues believe. Hampton, Loma Linda, Eastern Colorado, Buffalo, and now Ann Arbor all present issues that warrant our attention so that we can help VA improve patient safety and veteran satisfaction at those facilities. But let me be absolutely clear. The Restore VA Accountability Act will not fix those issues. The Restore Act is not going to hire more people to process referrals. It is not going to bring in more qualified executive leadership. It is not going to improve patient outcomes. What Restore will be is an empty promise to veterans and a tool used to harm the federal employees that serve them. I know that Ranking Member Ramirez and I are committed to work to ensure VA is an accountable organization that holds its employees to the highest standards for our veterans. So let's come back together and explore opportunities for bipartisanship, and I yield back.
Thank you. And before the chair introduces the witness from our first panel, I just think there's a time and place for partisan politics, and I really wish it wasn't in this committee. I think it's really important for us to continue to focus on the issues at hand, rooting out misconduct and ensuring the VA effectively holds those accountable who allow it, and that should not be partisan. I've said it before and I will say it again. Partisan games have no place when veterans' care is on the line. With that, I'd like to recognize the witnesses on our first panel. Testifying before us today, we have Mr. Ted Radway, the Acting Assistant Secretary of the Office of Accountability and Whistleblower Protection. We have Ms. Tracy Thurritt, the Chief Human Capital Officer, Office of Human Resources and Administration, Security and Preparedness. And we have Dr. Mark Upton, Deputy to the Deputy Undersecretary for Health, Veteran Affairs, Health Administration. And we have Mr. David Case, the Acting Inspector General of the Inspector General. And we also have with us Mr. Donald Sherman, Executive Director and Chief Counsel of Citizens for Responsibility and Ethics in Washington. And if the witnesses could please stand and raise their right hand, and we will swear you in. Do you solemnly swear that the testimony you are about to provide is the truth, the whole truth, and nothing but the truth? Thank you. You may be seated. Let the record reflect that the witness has answered in the affirmative. Mr. Radway, you are now recognized for 5 minutes to provide VA's testimony.
Good afternoon, Chairwoman Kiggins, Ranking Member Ramirez, Ranking Member Takano, distinguished members of the subcommittee. Thank you for inviting us today to discuss the VA's efforts to improve accountability within the department. Joining me is Ms. Tracy Thurritt, Chief Human Capital Officer in VA's Office of Human Resources and Administration, Operations, Security, and Preparedness, and Dr. Mark Upton, Deputy to the Deputy Undersecretary for Health. VA is committed to providing veterans with the care and benefits they have earned through service to our country. Our veterans and their families, caregivers, and survivors deserve nothing less. We and the more than 450,000 VA employees are devoted to this sacred duty and work diligently daily to fulfill this mission. Sometimes, even with the best intentions, the VA recognizes that the performance and action of some employees and leaders fall short of expectations and what our veterans deserve. When that happens, holding employees accountable is integral to effective management, and we take that responsibility seriously. In today's hearing, we welcome the opportunity to discuss our improvements to strengthen our accountability. The Office of Accountability and Whistleblower Protection promotes and improves individual and organizational accountability across VA in numerous ways. First, we investigate allegations against senior leaders involving misconduct and poor performance, and allegations against all supervisors involving retaliation against whistleblowers. Our highly skilled professional investigators and analysts work hand in hand with our attorneys, who ensure that investigations are properly scoped within our jurisdiction, all relevant issues and potential misconduct are identified, and the conclusions and recommendations are legally supportable and appropriate. We issue reports with recommendations for disciplinary actions, but we do not carry out those actions. Instead, our report is issued to the appropriate management official with authority to propose and/or carry out those actions. If our recommendations are not taken, we report that, along with the deciding official's reasoning, to Congress. OAWP employees have led a remarkable turnaround in productivity, success, and impact on individual accountability. From fiscal 21 to 24, the number of incoming complaints increased by over 60% to 3,305 complaints. This shows VA employees' trust in OAWP's ability to resolve complaints fairly and efficiently. Despite the rapid increase in case volume, OAWP's efforts have dramatically reduced the time it takes to close a case. From fiscal 21 to 24, we reduced the time it takes to close a complex case by over 75%. In addition, we've seen a jump in acceptance by management of our recommendations. In fiscal 21, management took some action or the employee retired or resigned in only 64% of our disciplinary recommendations. In fiscal 23, that number jumped to 100%, and in fiscal 24, we doubled the number of recommendations we issued, and management took some action or the employee retired or resigned in all but 3 cases, or 92%. We also issue non-disciplinary recommendations for relief for the whistleblower, training, or policy modifications. Management regularly takes these recommendations between 96 and 100% of the time. OAWP also drives organizational accountability. By statute, we provide advice, reports, and recommendations to the Secretary on all matters relating to accountability. In the past 2 years, this included providing the Secretary with 8 reports on the VA's efforts to support veterans with military sexual trauma. Half of the 32 recommendations have been implemented to date, driving greater organizational accountability and a better experience for our veterans with MST. OAWP also launches climate reviews that give leadership insight into the whistleblower reporting environment and make recommendations to improve the reporting culture to drive greater accountability and whistleblower protection. In 2019, VHA began a transformational modernization. The transformation into a high-reliability organization, or HRO, was central to this effort. An HRO is an organization that experiences fewer than anticipated accidents or events of harm, despite operating in highly complex, high-risk environments where even small errors can lead to tragic results. The department empowers all staff to lead continuous process improvements, and we strive to create an environment where employees feel safe to report harm or near misses. We are committed to continuing to build on the great strides we made in improving safety and quality of care. As VHA advances towards HRO maturity, leaders are applying an organization-wide commitment to zero harm by developing an even stronger safety culture, featuring empowered frontline teams supported by engaged leadership within a climate of trust and continuous improvement. The Office of Medical Inspector is responsible for assessing the quality of VA healthcare through investigations of VA facilities. OMI issues comprehensive reports of its healthcare investigations, including recommendations for corrective action and improvements to the quality of veterans' healthcare. While it does make referrals to OAWP, OMI generally does not make specific recommendations related to discipline. Instead, it focuses on oversight and improvement of veterans' healthcare. VA is proud of its large, dedicated workforce who work hard to carry out VA's great mission every day. The department is committed to and engages in continuous improvement of accountability to assess how to help identify and affect cultural improvements within the VA, hold employees accountable, and continue to work to protect whistleblowers. Thank you, and we look forward to responding to any questions you may have.
Thank you, Mr. Radway. Mr. Case, you are now recognized for 5 minutes to provide your testimony.
Thank you, Chairwoman Kiggins, Ranking Member Ramirez, and members of the subcommittee. I appreciate this opportunity to discuss how the Office of Inspector General's work enhances VA's accountability. The OIG shares your goal of putting veterans first, and we do that by conducting effective, independent oversight of VA so it can better serve veterans, their families, survivors, and caregivers. In fiscal year 2024, our office released more than 300 oversight publications with over 1,100 recommendations to VA. We made nearly 250 arrests and secured 179 convictions. We had a monetary impact of more than $6.5 billion in addition to the invaluable work of our healthcare inspectors who enhance patient care and safety. These efforts to improve benefits and services for veterans and their families would not be possible without the funding and support we receive from Congress. The engagement of VSOs and other stakeholders has also been crucial to our success. In addition, we have a strong collaborative relationship with GAO, and we coordinate our efforts with them to promote more consequential oversight. In my written testimony, I lay out the 5 principles that the OIG has determined are foundational to accountability and provide examples of each. First, there must be strong governance and clarity of roles and responsibilities. We have found tension between the VA office with policy and oversight functions and the leaders in the field who are not accountable to those offices. In other cases, staff do not fully understand their roles and responsibilities, due in part to outdated or conflicting guidance. Several of our healthcare inspections identified facilities where leaders did not act on known issues, resulting in greater risk to patients or delays in veterans receiving care. Second, there must be adequate and qualified staff to carry out clear duties. VA faces staff vacancies in key occupations, especially within VHA. These long-standing shortages make it challenging for VA to carry out some programs and functions. When implementing new programs, staff often must navigate rapidly changing guidance. For processing VA benefits, the resulting confusion can affect the amount of money and services veterans receive. Third, VA needs updated IT system and effective business processes. VA is modernizing significant systems critical to its operations. We have been proactively overseeing VA's implementation of these systems, including publishing 22 reports on the transformation of VA's electronic health record system alone. Our work has identified poor planning, billions of dollars in unanticipated costs, patient safety issues, low user acceptance, and gaps in functionalities making it difficult for personnel to efficiently do their jobs. Fourth, effective quality assurance and monitoring is essential. VA often lacks controls to consistently ensure quality standards are met. Breakdowns in routine monitoring and workarounds undermine efforts to identify and fix problems, as well as make certain the eligible veterans and their families receive timely services and benefits. And last, consistent and effective leadership is critical. Engaged and dedicated leadership fosters open communication, efficiency, and accountability among all staff. These 5 themes are routinely highlighted in OIG reports. Although report findings and recommendations are often directed to a single facility, system, or program, they serve as a roadmap to help prevent or correct similar problems in other facilities or offices. We recognize that VA is working to build a stronger sense of accountability. We routinely observe personnel committed to providing the highest quality care, benefits, and services to veterans and their families, despite obstacles. The OIG will continue to provide practical and meaningful recommendations to help VA remove these obstacles, to serve veterans first, and address fraud and other crimes, as well as waste and improve efficiency. Finally, I want to thank Congress for passing the Elizabeth Dole Act, which includes a requirement that all new VA employees receive training on how to report and cooperate with the OIG. Chairwoman Kiggins and members of the subcommittee, this concludes my statement. I look forward to answering any questions you may have.
Thank you, Mr. Case. And Mr. Sherman, you are now recognized for 5 minutes to provide your testimony.
Chairwoman Kiggins, Ranking Member Ramirez, and members of the committee, thank you for the opportunity to testify before you today. The Department of Veterans Affairs' mission to provide for the care, benefits, and support of veterans is the fulfillment of a promise that our nation made and must continue to honor to those who have protected our nation in the armed services. My own family includes veterans who served in combat, and my grandfather proudly worked at the VA in his hometown of Tuskegee, Alabama. I thank our nation's veterans and military families for their service and sacrifice for our country. In order to meet its critical mandate, the VA plays many roles, including administering pensions, insurance, and home loans for veterans, providing survivor support for veterans' families, and running the Veterans Health Administration, the largest integrated healthcare network in the United States. The VA cannot falter in this mission. Yet managing such complex systems is a daunting task. The VA has experienced challenges across both Democratic and Republican administrations that demand robust, independent oversight. It is certainly reasonable to look backwards at the Biden administration's stewardship of the VA and acknowledge areas of success and challenge. That's why it would have been useful to have former VA IG Michael Missel in attendance here today. During his tenure, Mr. Missel's leadership of OIG garnered bipartisan praise, and he released numerous reports critical of VA officials during both President Trump's and President Biden's terms in office. In 2024 alone, IG Missel's team published more than 300 reports with over 1,100 recommendations to help the VA improve the lives of veterans, with a monetary impact on at least $6 billion in taxpayer funds. Under Mr. Missel's leadership, VA OIG pushed the agency to address deficiencies in its assessment of suicide risk, healthcare failures at facilities like the Hampton VA Medical Center, as well as longstanding management challenges. Despite that staggering impact, President Trump fired Mr. Missel last month, along with more than a dozen other inspectors general. That is not normal. In fact, these firings were illegal. Provisions of the Bipartisan Securing Inspector General Independence Act require the president to provide Congress with 30 days' notice and an explanation before firing an IG. President Trump did neither. Although it is beyond my expertise to opine on VA's mission-specific operations, independent oversight is essential for the agency to better support our nation's veterans. President Trump's firing of IGs, including Mr. Missel, was unethical, and our veterans will be among the many communities harmed as a result of these and other authoritarian actions. These attacks include President Trump's gutting of the nonpartisan civil service. Veterans make up roughly 6% of the American working-age population, but nearly a third of the federal workforce. So efforts to fire, suspend, and demote civil servants across agencies disproportionately impacts veterans. President Trump's hiring freeze on many components of the VA likewise undermines the agency's work to meet the needs of veterans and military families. In January, my organization filed a lawsuit to force President Trump's billionaire-led DOGE to stop operating in the shadows and to the exclusion of veterans and other stakeholders. The administration has also terminated programs aimed at meeting the unique experiences of diverse veterans. Having an independent, permanent IG here today would be valuable to assess the impact of these policies and opine on reforms that this committee is interested in pursuing. That's why CREW has pressed for IG vacancies to be filled and for independent oversight under both Presidents Trump and Biden. The VA OIG vacancy is especially concerning given the corruption scandals at VA during the first Trump administration, including President Trump allowing cronies to help run the agency from Mar-a-Lago. OIG's investigation of Secretary Shulkin's lavish taxpayer-funded travel helped to lead to his removal in 2018. In closing, President Trump's ouster of Mr. Missel suggests that even his successor could be fired on a political whim. That fact does nothing to help the VA better serve veterans and military families, address the long-standing challenges the VA has faced across administrations, or prevent the corruption that plagued the VA during the first Trump term. If this committee is serious about oversight of the VA, then I would expect members of both parties to vocally oppose President Trump's illegal attack on IGs and the civil service. Thank you. I welcome your questions.
Thank you, Mr. Sherman. We will now move to questions, and I yield myself 5 minutes. And just before that, in accordance with Committee Rule 5E, I ask unanimous consent that Representative Moylan from Guam be permitted to participate in today's subcommittee hearing. Without objection, so ordered. Mr. Case, the VA Inspector General has published 3 different reports about concerns with the clinical care veterans receive at the Hampton VA in my district. Each report highlights the importance of having quality assurance processes in place. If these are not in place, patients bear the consequences. Can you tell me your opinion about why it's important for leaders to have quality measures in place for patient care, and can you also give us some examples of these quality measures?
Chairwoman Kiggins, we have published those reports, and the whole goal is to put the veteran first there. Quality assurance and important quality measures have to be in place. Adherence to defined processes and objective assessments of basic patient safety activities is critical. Leaders must be proactive in monitoring compliance and tracking and trending compliance so that with these foundational requirements. They then have to intervene, modify, or enhance resources in real time to keep patients safe if they see problems and there's constant monitoring. Example, and the best example is from Hampton, is there were ineffective monitoring of the processes to address substandard care by a surgeon. And by doing that, you allow a surgeon to stay in place who is believed to be not operating at the highest level or even at an acceptable level. And so by monitoring those processes, paying attention, demanding accountability, you ensure safety and patient safety.
So the IG also published a report that showed severe mismanagement in veterans' oncology care, resulting in serious delays, which is unacceptable. So how can leaders be proactive in their oversight and involvement in patient care? And you talked about, hands-on and just managing that care, but can you give me specific examples? Is this reviewing charts? Is this, periodic reviews with small groups? Just a little more specific.
Yes, as a general matter, trust is critical between leaders and staff, but verification of performance and adherence to policy and standards is absolutely necessary. The stakes are too high and the data is too readily available to assume patients are getting the care they need, especially those at high risk. And the best example that comes to mind is in Buffalo, where there was the chief of oncology, the staff oncologist were demanding that a patient get an appointment scheduled in the community. The response from others was, we're taking care of it, we'll get it done. But it wasn't getting done. And so that's an instance where you can trust, but you have to verify. You have to intervene and make sure that that patient is getting the care he needs, especially incumbent upon facility management, the staff oncologist, and the oncologist.
Which takes manpower, and then also people who are very thorough and attention to detail in doing those parts of follow-up for their jobs, which I can appreciate. Thank you, Mr. Case. And Mr. Radway, from your experience in the last 4 years, what has OAWP identified as repeat areas of concern across the VA and patient care?
So we haven't, Congressman, really focused on patient care issues per se. We really looked more at misconduct. We have seen several cases where there was a failure to oversee providers who were alleged to have committed misconduct in terms of patient care and improperly treated patients. And then we'll look at the activities of those senior leaders who failed to oversee their providers, their chiefs of surgery, things like that.
In the office, and Ms. Radway again, the Office of Medical Inspector is responsible for assessing VA's quality of care. How do the recommendations made in the OMI reports work to mitigate repeated errors in the care provided in the VA?
I think Dr. Upton, do you want to?
Sure. I'd be happy to take that, Madam Chairwoman. So the OMI recommendations come to both the leaders of the facilities as well as to our senior leaders in VHA. And they, as was mentioned earlier, look at important quality and safety issues within our system, often charged by the Undersecretary for Health or others. And the OMI specifically makes sure that those recommendations are followed through, and we take them very seriously as part of our commitment to quality.
So you follow up at each facility individually? Is that?
We review them as leaders, as a senior leadership team, and they also work with each facility because many of these are very facility specific, but we certainly try to take lessons learned across the system as well.
Very good, thank you. Let's see, and then we will now move to questions from the ranking members. So Ranking Member Ramirez, you are recognized for 5 minutes.
Thank you, Chairwoman. I want to just thank all of you for being here again, and I really appreciate your testimonies and having an opportunity to read through them. I want to do a little quick level-setting exercise with some of the witnesses here today, because I know a little bit on a time crunch, but I want to go down the row with 3 of you and ask you each to answer a question. Ms. Third, in your work, do you put veterans or VA first?
Congresswoman Ramirez, yes.
Veterans?
Veterans first.
Mr. Radaway, in your work, do you put veterans or VA first?
Veterans.
Dr. Upton, you're a provider who cares for veterans. Do you put veterans first or VA?
Veterans first every time.
Thank you. I want to make sure that the record shows that it's crystal clear that these public servants before us put veterans first. And I believe them. We relied on each of you during the last 4 years to ensure the VA continued its journey to becoming an accountable institution that prioritizes patient safety. And I just want to thank you for your service. Now, Ms. Therrett, I appreciated VA's testimony that you provided regarding actions taken to hold employees accountable for misconduct. I want to ask you a couple of follow-up questions. How frequently does the VA use its authority under Title V to remove employees?
Congresswoman Ramirez, last fiscal year, we used our authority under Title V and the Accountability Act because we use both of the authorities. We use 713 in the Accountability Act for our senior leaders and the Chapter 43 and Chapter 75 authorities in Title V. There were over 5,000 actions that we took to remove, to suspend, or to demote employees who engaged in poor performance or misconduct. That number mirrors about the same number that were taken the first year after the Accountability Act was
So
passed.
pretty frequently. And how recently have you used Title V authority? When was the last time?
We use the authorities that we have on a daily basis.
Got it. I'm looking at a chart right now that compares year over year the total number of adverse actions taken by the VA. And it says that for year 2024, there were 5,875 adverse actions. You just mentioned that. In year 2024, the VA would have been using Title V authorities for adverse actions, as you mentioned, correct? So just to follow up, the chart says that in 2018, 19, 20, 21, and 22, the VA had 5,952, 5,653, 5,694, 4,673, and 4,068 adverse actions, respectively. During that period, which authority or authorities for adverse actions would the VA have been using?
So prior to fiscal year 2023, we were using a combination of Accountability Act, Chapters 713 and 714 authorities, in addition to our Title V authorities. I would say that we are always using all of our authorities, whether under Title 38 or Title V, to ensure our Title 38 and our Title V workforce are being held accountable.
Got it. So VA uses Title V at the same or higher rates for adverse actions than they did with the authorities in the 2017 accountability law, correct?
Correct. We have a track record of legally defensible actions under Title V because they've been before the Merit Systems Protection Board. They've been before third parties. So anytime we take an action, we want to make sure that that employee does not come back if we remove them. If they're suspended, that suspension is upheld. So we try and look at the case law to make sure that the actions that we are taking are legally defensible and that we won't have to reinstate bad actors who shouldn't be at the VA serving veterans.
Well, that sounds efficient. Ms. Therrett, my understanding is that you sit on council with other agency chief human capital officers. Is that correct? Yes?
Yes, ma'am.
All right. So I have another follow-up. Are there other federal agencies that also employ physicians, nurses, and housekeepers like the VA?
There are the Department of Health and Human
Yes.
Services, the Department of...
So let me ask you, I have a couple seconds left here. Do those agencies also use Title V to discipline employees?
They do.
Yeah. Ms. Therrett, can you describe an instance when you could not remove an employee under Title V?
If there are instances when an employee can't be removed under Title V or Title 38, it is typically, as Mr. Radway alluded to, because of a lack of evidence, an inability to support the level of discipline that's being proposed. So rarely is it the authority that is limiting it as opposed to the substance of the investigation or the prior conduct or performance of that individual.
Thank you, Ms. Therrett. Just a quick question to Mr. Sherman. Thank you for being here again. How would you describe the first 20 days of the Trump second administration in the last 10 seconds? Hard, I know.
Lawless, evasive, chaotic. I think if the president was serious about oversight of the VA in particular, he wouldn't have fired the IG and he wouldn't have sent minions from DOJ to
Thank you, Mr. Sherman. I yield back.
Thank you, and I recognize myself for 5 minutes. First of all, I want to thank you for being here. I want to assure you that you are not stage props. The hysteria and the hyperbole that you have heard today will not stop this committee from conducting reasonable oversight, which is our duty. Mr. Case, your testimony, particularly your written testimony, is pretty damning. I'll just quote a few sentences from it. Accountability, components of accountability identified by the OIG are often lacking within VA programs and operations. And you listed the 5, gave a very detailed. The OIG regularly identifies instances of misconduct, broken systems, confusing and conflicting governing policies or guidance, and inefficiencies or missteps in implementing programs. Further, you say, misconduct, failures to take appropriate action, persistent problems are often the result of VA personnel or contractors not understanding their roles or responsibilities. In other cases, they understand their duties, simply do not or cannot fulfill them. This may be due in part to outdated policies and procedures, conflicting guidance, lack of clear decision-making, often by those best positioned to act, lacking the authority to do so, and you go on. Everything that I just read is a leadership issue. I will tell you that during my first term in Congress on this committee, we spent an inordinate amount of time on countless scandals throughout the VA, normally at the leadership level. In the past 2 years, under the Biden administration, we've been made aware of many cases not executing their jobs, employees not executing their jobs. This subcommittee sent over 80 letters to try to uncover why that is. I can only compare it to a dumpster fire in a windstorm. If you think it can't get any worse, it blows up again. So, Mr. Case, I want to go to you first. Have you found VISN directors exercise inconsistent oversight? And this is leading to another question, leading to major disparities in quality of care and leadership across the VISNs.
We have found disparity in oversight by VISN directors, largely attributable, we see often, in the fact they don't have clear definitions of what their responsibilities are and what their duties are. And this isn't just VISN directors, it goes to all leadership, mental health directors at the VISN level. So we have found that, and once the responsibilities and duties are clarified, then I think they'll be in a position to move forward.
Do you attribute this to lack of leadership at the VA leadership level, the secretary administrative level, or is it they have too much autonomy at the VISN director level? Again, leading to another question.
Yes. How the VA got itself in this situation is probably a long story, the level of autonomy granted, but autonomy can work if there's standardization of duties at the highest level, at the VISN level, and those duties are clear. But as it exists right now, there is not that clarity for VISN leaders to act on their duties.
Okay, let me go to the EHR because, and I realize it probably is not in the core mission of this hearing, but is it not true from the OIG perspective that we can't get to a clear EHR solution because the customization at the VISN level? Is that a true statement or not?
That could be part of it, and it is probably part of it. There are many reasons, though, why EHR is in the state it's in at the present.
And the ethics violations? We covered, probably all the way from sexual to bonuses, those scandals that I referred to. To what would you owe that?
Yes, I owe that. It depends on the instance that we're trying to address. Sometimes it's personal malfeasance. It boils down to that. Other times, malfeasance is allowed to go on. It just varies, and it's individualized. And so that's why our reports are very specific and focused and practical.
Okay, in the last couple of seconds, Mr. Radway, do you track instances where VISN leadership intervenes? Do you identify cases where interference allows people to be transferred as opposed to held accountable? Quickly.
We don't track whether people are transferred. We just track whether the VISN leaders, if they're the deciding official, implement the recommendation for discipline or not.
Okay, thank you. I yield back and recognize Mr. Conway.
Thank you.
Dr. Conaway, I apologize.
Well, thank you for that. I appreciate that. Thank you, Mr. Chairman. Thank you, lady and gentlemen, for presenting yourself to us today, and hopefully we, working together, can bring about the necessary improvements to ensure that the VA meets the demands of the American people and certainly the desires of our veteran community to receive first-rate service at the VA. I would like to follow up, however, on a question that was just raised about ethics and to raise a concern about the President's actions upon in office with respect to EOs. And my notes say here that among the rescissions that the President made, changed the ethics commitments by executive branch personnel and others with respect to gifts and the like. Have any recent changes in the administration impacted the ethics rules governing the highest reaches in the VA? That's either for Mr. Case or Mr. Sherman. I'll help out that way.
Well, I think when President Trump came in, he rescinded the ethics pledge for appointees in the government and significantly weakened those rules, making it easier for appointees to accept gifts and to move back and forth between the private sector and the public sector. And so certainly I would be concerned about conflicts of interest, undermining the efficacy of service that the American people, including our veterans, get from their government.
And from the IG perspective, we will look at issues that are raised to us, and we will investigate those and do reports if we do investigate those, but we don't address broad policy issues, and we don't address on a significant way what is the result of those policy issues until we have specific requests to go and look at specific instances. That's basically our people meeting standards. That's how we operate in doing our reports.
Well, thank you for that, and I just have to say that these ethics rules are intended to ensure that the vendors who work for the VA, public money is being spent there, and if someone's getting gifts or not behaving appropriately with respect to the awarding of contracts and overseeing those because of gifts, then we're going to see a waste, and we're going to see, as we've seen, unfortunately, throughout the VA, serious problems with implementing the systems for everything, for getting appointments, the EMR, which is just mentioned, and many other things in the reports that we've gotten that have looked at cost overruns and the inability to get these critical systems implemented and online. Mr. Radway, again, thank you for being here. Can you describe how the OAWP improved the quality of investigative work over the last 4 years during the Biden-Harris administration, and have improvements been made, not been made? We noted here that there are a number of investigations under the current authorities that have led to more than 5,000 people being removed from their jobs for various infractions. Can you describe how the OAWP process has worked with respect to quality of investigations?
Sure, Congressman. A lot of it has to do with hiring the right people, hired skilled 1810 administrative investigators, many of whom are retired military or retired law enforcement and are on their second career. We instituted standard operating procedures based on the Council of Inspectors General of Integrity and Efficiency investigative standards, and we modeled those standards for our investigation. We've given our folks training, and we established the Investigative Attorneys Division, which ensures that our reports are legally sufficient and our recommendations are legally supportable.
Again, I don't know how much time I have, but Mr. Sherman, can you talk about the, regarding the reinstatement of Schedule F by the current administration, how will this executive order create a VA that is more prone to corruption versus one that prioritizes accountability, and the well-being and care of veterans?
Well, certainly weakening civil service protections makes it easier to fire government workers, nonpartisan government workers, when they report misconduct by the political leadership of the agency. It makes it less likely that people will report misconduct, and it makes it more likely that the civil service is subject to partisan pressure, which is exactly what we don't want our veterans to experience when they come to the government for help.
Well, with the time I have, I just want to say that we need a professionalized civil service and not people who are amateurs coming in there on political appointments that are not accountable to their mission, but rather to the appointing authority. Thank you, Mr. Chairman.
I recognize Mr. Subcommittee.
Thank you, Mr. Chairman. Our ultimate duty here on the committee is to ensure veterans come first and not senior executive bureaucrats. It's one thing to be able to say that and then another to act on that. Arizona is sadly the epicenter of what can go wrong when oversight is not taken seriously, as we saw in 2014. It was referred to that earlier today as well. While we seek to ensure the VA is effective, we also have worked to create great public, private, and VSO partnership programs to fill the void in the community in Arizona as a result of what happened. One example is the Be Connected program that for years has partnered with VA to ensure veterans are able to access the resources and benefits they have earned. While ensuring these partnerships continue, I want to make sure recent events in Arizona, such as a veteran passing away in the parking lot of the Phoenix Medical Center, or a physician improperly administering care to veterans, cease to occur. Now, when we, Mr. Radaway and Mr. Case, this will be going to you on the issue and the topic of the senior executive staff improper bonus pay. So last Congress, it was discovered, and in this area, I would like you to please provide some insight as well as giving into the OIG's work. Last Congress, it was discovered SES pay bonuses were paid despite the purpose of these dollars being allocated for frontline healthcare workers who are day in and day out serving our veterans. What is the VA doing to, one, regain trust, two, ensure this doesn't happen again, and three, how do you plan to continue oversight work with the new administration, given its presidential memo regarding additional accountability for SES employees?
So, Congressman, in response to the IG report on critical skills incentives, or CSIs, our office was tasked with conducting an investigation into that episode, issued a 165-page report to the Secretary with recommendations for disciplinary and non-disciplinary action, including policies and procedures that would prevent that from reoccurring. Most of our recommendations to date have been implemented, and we have not seen any issues of reoccurrence brought to our attention, but if they were, we would certainly investigate those as appropriate.
We have received a response to our recommendations asking that they've been closed from the VA. It came on January 10th. The closure of recommendations and whether the VA has met the action plans they have put forward is not a binary process. It's not a yes or no process. Oftentimes, it requires a discussion with VA as to what they've done, have they done enough, and see what their response is. So we are analyzing those right now. From our perspective, I think some of those can probably be closed, but I think others are going to require this ongoing discussion as to what's been done and is it sufficient to meet the action plan of the recommendations.
What about my last part of the question regarding the new administration giving the presidential memo regarding additional accountability for SES employees? How does that play into what you just explained?
Yes, so when we do our work, we hold VA to standards, and those standards could include legislation, regulation, VA policies, clinical policies, whatever it is that we're trying to investigate, we hold them to standards. And if they come up short on those standards, then that will be part of our report, our findings, and we'll make recommendations, and then follow up to see if the action plans are implemented in the way that meets those recommendations. So this would be part of that process, sir.
Running out of time here, but just moving on, one of the major concerns is the number of times I've seen individuals resign while under investigation as well in an attempt to avoid accountability to their actions or for actions of those they oversee as well. That happened repeatedly. It was mentioned by the chairman in terms of how many of those we saw in this committee. So how does this impact accountability and the investigation processes?
So it does happen, sir. It doesn't impact the investigation itself. We'll continue and close out our investigation. But I'm going to defer to Ms. Theret to speak about the consequences of that.
So Congressman Subcommittee, two things that I would offer. One is we do have authority under 5 U.S.C. 3322 to annotate personnel records when someone resigns under an investigation. I will tell you that authority is very limited to certain circumstances, and we can't use it broadly. So I know later this month we have a legislative hearing, and we're looking forward to sharing some views that we have on more things that we can do to improve accountability at the VA.
Well, I'm interested in participating and helping in any way on that, Mr. Chairman. I think that whenever someone saves themselves from any consequences by resigning, that's an accountability problem. So, thank you.
Mr. Kennedy.
Thank you. Thank you all for your testimony. Thanks for your service to our great country. Dr. Upton, I understand that you've been involved in improving the care and the community program at the Buffalo VA Medical Center. Are you fully read into the OIG report and what was found in that report and what's been recommended for the Buffalo VA Medical Center in the fall?
Thank you, Congressman. As a healthcare provider myself, as was mentioned earlier, as well as someone that works nationally, we need to make sure when veterans are referred for care that it happens timely and in a high-quality way. And certainly that was the challenge, the significant concern we heard in Buffalo. And I will say when that concern came to us, our Undersecretary for Health very swiftly pulled a team of experts together from various disciplines to go to Buffalo directly, as you know, sir, and really look at all aspects of the issue there, from process to education to staffing, to ensuring the right reviews are occurring of leadership as well. And
so you are familiar?
I'm very familiar, yes.
Excellent. Well, thank you. And the Undersecretary came up at my invitation, and we had a very productive meeting with the leadership of the staff at that hospital. And one of the issues that came up was a lack of staffing. And through what you've read in the OIG report and in order to achieve the OIG recommendations, do you believe that it's important that the staff is hired to a level that's necessary to provide the service to our veterans?
I do, Congressman.
The VA is currently under a hiring freeze, is it not?
We are complying with the orders from the administration, but we have received a number of exceptions for important critical roles within the healthcare delivery system.
So what is the VA doing to get more hires at the Buffalo VA specifically to help the veterans get the care that they need?
I know that the current leadership at the Buffalo VA, as well as the VISN, are taking that very seriously, and I'd be happy to follow up with you directly, Congressman, on the specific hiring in various key areas there.
Well, it's important that the hiring is up to a level that the hospital and the system functions. When the fork in the road email went out, there was a Department of VA memo that stated that there were approximately 1,900 plus jobs that were rescinded and 716 job postings that were removed from USA Jobs. Those are positions that are effectively providing service to our veterans, are they not?
We are absolutely committed to hiring all the key positions we need, Congressman, and we're able to repost a large number of those.
I understand what you're saying, but I'd like to know precisely how Buffalo VA is indicative of what's happening around the country. If there is a hiring freeze in place, and what we're hearing, not only in my district but across the country, is that there are individuals that are being put on performance improvement plans. There are people that are on probation that are being cut without explanation. And are those positions being hired? Because it sounds to me and others that we're hearing from, again, my constituents, that we're blowing a hole in the staffing levels at not only the Buffalo VA and the Buffalo network, VA network, but across the country. Can you speak to that?
I will say that we are absolutely committed to hiring key staff, and I agree with you, Congressman. It is so important that we bring the staff in to serve veterans, and the specifics of Buffalo and the network, I'd be happy to follow up with you with, but I certainly understand your concern.
How can we be confident that the VA network across the country is being staffed appropriately when in fact there have been jobs that have been rescinded, offers that have been rescinded, and postings that have been removed, and thousands of jobs and postings, and there are reports of individuals, again, being put on performance improvement plans that ultimately we know is the first step toward termination, and individuals that are currently in a probationary hiring period that are being terminated without cause.
I will say we are going to stay laser focused as a health administration to hire all the employees that we can and follow all accordant directives and guidance, but we're laser focused on bringing the critical healthcare workers we need, Congressman.
I'd like you to please provide in writing to this committee, this subcommittee, a hiring chart of exactly what's happening, where the hirings are, where the staffing levels are open, and all of which have transpired since the Fork in the Road memo went out. I yield back. Thank you.
Mr. Moreland.
Thank you, Chairman Self, Ranking Member Ramirez. I would like to thank the subcommittee for the opportunity to speak on behalf of the veterans of Guam, who have been some of the most dedicated and selfless members of our nation's armed forces. Despite Guam having the highest enlistment rate per capita in the United States and one of the highest concentrations of veterans, our island has consistently been left behind when it comes to access to resources and benefits they deserve from the VA under the previous administration. So there's an ongoing discrepancy between the number of veterans reported by the government of Guam and those recognized by the VA. This is likely due to the VA's reliance on the number of veterans registered, without considering the need for increased outreach and support to those who have not been connected to the system. We know that our veterans in Guam have sacrificed so much in service to this nation. It is our responsibility to ensure that they are not left behind simply because they live in geographically isolated territory. The failure of the VA to provide adequate staffing, oversight, and resources for Guam's veterans under the previous administration is a situation that demands immediate correction. Today's hearing is a crucial step in ensuring that the brave men and women of Guam who have served our country and are no longer neglected. We must take action to provide the support and services they have earned. For my first question, Dr. Upton, Guam currently falls under the VA Pacific Islands healthcare system, which services the largest geographic region in the country. How does VHA determine resources allocations for its facilities in the territories, which face unique challenges in accessing federal resources and services?
Thank you, Congressman, and I want to echo how important it is that we serve the veterans of Guam and appreciate their service. As you mentioned, Guam is part of that particular VISN network, and we look at the veteran population, the services they need, the location of various facilities, as well as in VA and in the community. And I would be happy, Congressman, to sit down with you and that VISN leadership to talk about the needs in Guam from a healthcare perspective. I know that it sounds like we can do better and they need support, and I'd be happy to work with you.
Thank you. Next question, let me... for Mr. Radaway, how much oversight exists when issues arise in Guam and the other territories? How often are visits conducted, and how does the VA address these matters?
So I can only speak to oversight of the senior leaders. I don't have numbers for you on how many investigations we've had in Guam. I can certainly get those numbers for you, Congressman. But if we receive allegations, we would treat those just the same and investigate them just as we would any other prison or facility.
All right, thank you. And last question, Ms. Turret. A consistent issue brought forth by my constituents is how does the VA decide where staffing is needed, and how is the annual review conducted to determine if staffing needs to be increased?
Congressman Moylan, thank you for that question. In terms of the staffing resources and models that the Veterans Health Administration uses, those are assessed on an ongoing basis. We publish data on a recurring basis. On a monthly basis, we publish a public-facing report that looks at staffing levels. And then on a quarterly basis, we report on the Mission Act 505 section with respect to our vacancies and our staffing levels. Where those staffing levels need to be adjusted, I think as Dr. Upton mentioned, that local leadership will work with their VISN leadership to make sure that they're getting the resources and the budget and the allocations that they need to ensure that the services are being provided in a timely and high-quality manner. So those assessments are ongoing. If there are any circumstances that you want to discuss specifically in your area, glad to take a closer look at that with the VHA HR team.
Appreciate your time and all coming and testifying before the subcommittee. Thank you very much, Mr. Chairman. Thank you.
Thank you. I want to thank the witnesses for coming today, for your candor, for your willingness to come, and to the VA for providing the witnesses, the expert that they have. We need to ensure the VA has good governance. Veterans are getting the quality care that they deserve and they've earned, to quote several members from this side. Absolutely, that's imperative. That starts with ensuring that all employees are held accountable. Leadership culture matters. Restoring accountability remains a top priority of this committee, and I'm speaking for the chairwoman. We all look forward to continuing to ensure that VA remains committed to this goal. We all look forward to the leadership of Secretary Collins, and I believe that we will see a dramatic difference. Ranking Member Ramirez, closing comments.
Thank you, Chairman. I also want to echo the sentiments from the chairman now. We're really incredibly thankful for you to be here today. And this committee is going to be incredibly important over the next few weeks, over the next few years. We have to make sure that we use oversight and we use every authority in our power to ensure that we put veterans first, that we ask hard questions, that we make sure that in everything we do, we're centering veterans and their families. For many years, I got to shelter them. I fed them. I helped them find jobs. It's the work that I've done from a very young age. I know I look young, but that was almost 20 years ago. So I want to say that as I'm thinking about and transitioning out of this hearing today, I am concerned that at no point during this hearing today, we mentioned on this side, we certainly heard it from Mr. Sherman, but we didn't address the removal of the VA's Inspector General, Mike Missel. And let me just say, despite the fact that in this last Congress, Republicans relied on his testimony 22 times. Let me repeat that. Republicans relied on his testimony 22 times. I have not heard anyone talk about his removal. And it doesn't surprise me, but it doesn't make it right. I've said it once and I'll say it again, accountability for members of Congress has to be one of our priorities. And the president made it very clear when he removed over a dozen qualified inspector generals, including the VA's former Inspector General Missel. From our own records, we can agree that Mr. Missel's work was apolitical. He did his job and held the VA to standards that ensured veterans were treated with dignity and got the care they earned. Not once did my colleagues raise concerns or questions Mr. Missel's integrity as they relied on his testimony. In fact, they thanked him for his transparency. They thanked him for his directness when discussing issues he and his staff uncovered at the VA. Yet now, my Republican colleagues are silent following the marching orders. For a group of people fixated on qualifications, it seems like the only qualification that now matters is loyalty to the president or Musk. And let's be real here. We can't have an honest conversation about accountability at the VA without addressing Mr. Missel's removal. And it's why I want to make sure, Mr. Case, that you know, and you hear this from me, I'm deeply concerned about reports that Elon Musk and his teenage intern team went in, and who are not government employees, at least I'm not aware that they are, were at the VA central office earlier this week. Look, I don't think they have legal authority to direct the people and the resources of the VA, and they don't have authority to access the VA data. This feels like an abuse of power, so I am going to be officially requesting the Inspector General to initiate an investigation into this and report back to Congress as whether Musk or his team were or are currently working at the VA, who they're meeting with, what is being discussed, what veteran data is being assessed, and whether that access is lawful. That is the responsibility that we have here, oversight and accountability. So I look forward to working with you, and Mr. Chairman, I yield back.
Thank you, Ranking Member, and thank everyone for being here and the audience included. I ask unanimous consent that all members shall have 5 legislative days in which to revise and extend their remarks and include any extraneous material. Hearing no objection, so ordered. This hearing is now adjourned. All righty. You betcha. You got that.